Hello everyone, my name is Logan Schultz. I'm one of the previous Global Health Fellows at St. Joseph Clinic. I'm in Thomasik for a little bit of time, so Medical Missionaries asked me to just do a little tour of the clinic for you all tonight. So let's go ahead and get started. St. Joseph Clinic, which can be seen by the red pin here, is located in the Central Plateau of Haiti and is the only permanent medical facility serving Thomasik and its outlying villages. As you can see on this map, Thomasik is located on the right side in the middle. Surrounding the clinic, we have an aggregate of 5 community health centers that are staffed by trained community health care workers as well. So here's the entrance of the clinic, and now we'll enter and start the tour on the right side. Alright, so as you enter the gate here, this is where we have the Medica Mamba program. And Thomasik is located in an area of crisis level food insecurity, and the Central Plateau of Haiti has one of the highest rates of childhood malnutrition in the Americas. So here's Willer. He is the director of the childhood malnutrition program at the clinic, and this is where we see caretakers and their children for their weekly appointments and for screening as well. On average, there are 75 malnourished children simultaneously enrolled in the program. So the main tool that we have in our arsenal for treating malnutrition is called Medica Mamba, which is a ready-to-use therapeutic food, or RUTF, which is designed to provide nutrition to acutely malnourished children. During their regular visits, Wilner delivers a health education session to caretakers in the program and provides individualized care to each child by monitoring their progress. Village visits during our weekly mobile clinics also allows us to reach families in more remote areas. Wilner and our 5 community health care workers also conduct house visits to children in the program, allowing us to follow up with high-risk children and provide the family with additional health education. The clinic also has a vaccination program that operates weekly at the clinic, and then it also has posts throughout our 5 outlying villages as well. Alright, so next up is this Red Sea container. So this holds our manna packs for our school lunch program. This program has been operating since 2008, and currently it supports 6 local schools. And currently there is 1 trimester left of meals in there, which is good for 40,000 children. So with the advent of the COVID-19 pandemic, which has impacted all aspects of life, it also has had a particularly devastating effect on food insecurity. The World Food Program estimated that acute hunger would sharply increase due to COVID-19, especially affecting the most vulnerable countries such as Haiti, which has ranked in the top 10 worst food crises worldwide in previous years. Therefore, given rising food insecurity, and since the clinic only has 1 more trimester of meals remaining for this program, this is something we're hoping to fundraise for so that we can continue in subsequent years. Alright, if we go this way, this is where we have the CTC area. So we have 2 buildings, a laboratory, some restrooms. So this was built back when we had the cholera outbreak in Haiti. And then if we continue up this way, you can see the residents right here. So this is where the doctors, the social service doctors, the global health fellows, the midwives, and the nurses sleep. And then we also have a kitchen in there as well. Alright, and on the clinic grounds, we also have a agronomy program, which is called the Breadfruit Program. So we have a series of adult lamb veritab trees on the outside here. And with this fruit, it's very highly nutritious, and our strain is specifically high in protein as well. And we'll also take this fruit and make breadfruit flour, which we'll distribute to the Medica Mamba program and the caretakers there. And then right here, this is our nursery for the program. So if you follow me inside, this is where we are propagating breadfruit seedlings, which we subsequently help distribute to our 5 outlying villages. By increasing the number of nutritious fruit trees in the area, this program aims to address household food insecurity and provide families with a commodity they can sell in the local market. During our first year of expansion, the program distributed 270 breadfruit seedlings to 95 farmers in Thomasik. Alright, so having just left the breadfruit nursery, right now we are behind the residence, kind of in the back area of the clinic grounds. So the clinic has recently cleared the land and we're planting some more crops. And then if you look over to this direction, we have this building here, and on top is where we have our Matwan, or traditional birth attendance meetings. We also host our community healthcare worker meetings there. And when we have visiting groups from the United States, we'll actually use this building as well as their sleeping quarters. The clinic is always happy to host visiting medical, electrical, and construction teams. Each group brings invaluable knowledge and expertise to supporting the clinic and helping improve the lives of those in Tamasik. Each month we invite our 37 Matwans, or traditional birth attendants, to the clinic for continued education and clean delivery kit distribution. Matwans are educated to facilitate home deliveries in the clinic's 5 outlying villages and have been educated on delivery practices, hygiene, and pre- and postnatal care. They are also trained to identify complications that arise during labor and delivery, subsequently referring these cases to the clinic. We average about 200 births each month between all of our Matwans and the villages they serve. We actually just recently had a Matwan meeting this past week, so we wanted to share with you a small clip of an education song they learned during their original training. So here is the map of Tamasik again, and you can see the 5 outlying villages in which they work. Within these villages, we also have 5 community health centers staffed by trained community healthcare workers who provide first aid and basic healthcare for their villages. The community healthcare workers also assist with mobile clinics, the Medikamamba program, community education sessions, the clinic's vaccination program, referring at-risk patients to the clinic, and conducting home visits to community members. Each community health center also has a community health committee. In these photos, you can see my co-fellow Kira and me with 2 of these committees, one in Darlagra and the other in Balloon. These committees are comprised of community volunteers who assist with our mobile clinics, inform the clinic of local community health issues, help promulgate important clinic events, and provide health education to the village at large. We also host mobile clinics with physicians, midwives, the director of the Medikamamba program, and a pharmacy technician in one of the 5 outlying villages each week. This is an extremely invaluable initiative for the clinic, as one of the biggest barriers to receiving health care for those living in remote villages is the large distance to the clinic. Alright, so right now we're out front of the clinic. The clinic has been open since 2006 and has been running continuously since then. We work with certification by MSPP, which is the Haitian Ministry of Health, and we're staffed by an exclusively Haitian workforce here too. So what I'll do now is I'll show you some pictures that I've taken and kind of explain to you different areas within the clinic as well. So when a patient comes to the clinic, they will first check in at reception, where they will give us their dossier number, or we will create one for them. Then the patient will go to the triage area while our archives department searches for their dossier in preparation for seeing a clinic physician. During triage, patients also receive health and wellness education from a clinic staff member. Afterwards, patients will go to one of our consultation rooms where they will be examined by one of our clinic physicians. If a lab test needs to be performed, the patient will visit Elizabeth, our lab technician. Here is a picture of one of the corners of the ER, which is one of the busiest departments in the clinic that operates 24/7. Adjacent to the ER, not pictured here, we also have an operating room which is used by visiting teams from the US. Continuing down the hall from the ER, we reach one of the consultation rooms that is primarily used by our chronic disease treatment program, which was developed to combat the high incidence of hypertension and other chronic health concerns that are seen at the clinic. Lastly, we have 8 patient rooms, which are used if a patient needs to stay at the clinic to be observed overnight or for an extended period of time. Our maternity department is another one of our busiest areas of the clinic. Each month, our midwives help with between 30 and 50 births, and in 2020, the maternity department conducted over 3,300 consultations. Midwives also give health education classes to mothers during their prenatal consultations, and after delivery, the clinic also has a health worker who conducts postnatal visits and provides education about caring for a newborn baby. The maternity department also works closely with the clinic's community health care workers and Matwans as they refer patients to the clinic. Some of St. Joseph Clinic's staff, including one in maternity, actually have a sponsor to cover their salary. Supporting the salary of one of our healthcare professionals is one of the numerous ways you could make a significant impact on assisting the clinic and its operations. All right, and if we go this way, we have the clinic's depot. This is where we store most of the medical supplies, such as bandages, catheters, etc. And right next to that, we have the pharmacy depot. This is where Junior and Met Kelly are right now working on organizing some of the medicine that we have and taking stock. And very lastly, this is where the pharmacy is. This is after patients see one of the physicians and get a prescription, they'll come here and get the prescription filled before leaving. In April 2020, St. Joseph Clinic had a devastating fire which destroyed most of the electrical system. The clinic heavily relies on electricity for much of its services, including running our 24/7 ER and maternity, using our medical machines, and providing power to the refrigerators for our vaccines and lab tests. Therefore, building a new and reliable electrical system is another one of our long-term fundraising goals. All right, thank you all for joining me on a quick tour of St. Joseph Clinic so I could introduce you to some of our programs. I didn't have much time because I know you have a busy schedule tonight, so if you want any more information regarding these, feel free to shoot us an email or visit our website as well. And thank you so much for your continued support throughout the years. It's thanks to you that the clinic is able to function, as well as all these individual programs as well. So, merci un peu.
Good morning or good evening, everybody. My name is Dr. Lauren, the Chief Physician of the Clinic St. Joseph in Tomasik. We are very happy to talk to you, and we would like to thank the medical missionaries for all support that they bring to the clinic and to the people of Tomasik. Without their support or help, the clinic won't be able to functioning. And we deserve a lot of area like Bolum, Salmonvlat, Nankwa, and Daligram. And we do mobile clinic here without your support, and we cannot go far from the clinic to help people who cannot come to the clinic for the distance. And we are very grateful to you and for all the team who usually come to the clinic to help people with their help, like Dr. Bozako, Dr. Pena, and all the other nurses and doctors were usually here to help us. And we want to thank the fellows, Logan, and all the other staff, the electrical staff who usually come to help the clinic with electricity, and the construction team also. And we are very happy to talk to you, and we hope that your help will continue to help the people of Haiti, especially the people in Tomasik and area. And we wish you a good day, and we hope God continue to bless you and give you more opportunities to continue to help the people in Tomasik. Thank you very much.
Good morning, good evening, everybody. I am Junior, the clinic manager I would like to say you thank you for the whole support to the clinic. Thank you for the hard work you do for us. Thank you for support the clinic for a long time. Thank you for the whole program you support. Without you, we can't function. We say thank you a lot for the whole program. Thank you so much.